Hi, this project is for clinical integration. Our module was to cover the MRI. Group members include Meg, Caitlin, Chelsea, Andrew, and Wes. You can navigate along as I narrate by clicking the button at the bottom, or you can set it to automatically play. We hope you enjoy the presentation. To start, I will discuss the parts of an MRI machine. The main part of the MRI machine is the magnet, which is part of the horizontal tube that the patient enters. Most MRI systems use a superconducting magnet, which consists of many coils or windings of wire through which the current of electricity is passed, generating the magnetic field. The maximum strength of a magnet approved for medical imaging of a patient is between 1.5 and 3.0 Tesla units. The resistance in the wire is reduced to almost zero, a concept called superconductivity, which helps to maintain the massive amount of energy required for the magnetic field. This is accomplished by keeping the wires cooled and continually bathed in helium. There's also three gradient magnets inside the MRI. They are much lower in strength and create a variable field that allows different parts of the body to be scanned. There are sets of coils that transmit radio frequency waves into the patient's bodies. Again, there are different coils for different body parts: the knees, the shoulder, the wrist, the head, the neck. A patient slides into the machine on a table, and the body part to be scanned is in the exact center, also known as the isocenter of the magnetic field. Now I'll discuss a more simplified version of how the MRI works. Atoms spin it in random directions around their individual magnetic fields. In terms of the MRI scan, the main concern is the action of the hydrogen atoms, because the body is made up of water and fat. In the magnetic field produced by MRI, atoms line up either north or south. About half the atoms go each way, but there are few unmatched atoms. When radio frequency pulse is applied, the unmatched atoms spin the other way, and when the radio frequency is turned off, the extra atoms turn to normal positioning, emitting energy. The energy sends a signal to a computer, and the computer uses a mathematical equation or formula to convert the signal into an image. The types of the MRI scans. There's two basic types of MRI scans, T1 and T2. When the radio frequency is turned off, the longitudinal magnetization increases and the transversal magnetization decreases or disappears. The longitudinal relaxation is described by the time constant T1. The transversal relaxation is described by the time constant T2. T1 depends on tissue composition, structure, and surroundings, and is expression of the time it takes for the energy imparted by the radio frequency pulse to be transferred to the lattice of atoms that surround the nuclei. T2 interactions do not involve a transfer of energy, but only a change in phase. T1 images are good for delineating ocular anatomy, as fluid appears dark and fat appears bright. T2 images are best to discern pathology. Fluid is bright, processes that are dark on CT are bright on T2. Why we use the MRI. The MRI does not use ionizing radiation and no short-term or long-term side effects. It is preferred over CT in pediatric and childbearing female populations and produces variable thickness, two-dimensional slices, in any orientation through the body part of interest. The MRI provides far better contrast resolution and tissue discrimination in many areas compared with X-rays or ultrasounds. Safety of an MRI. There are no definite long-term harmful effects that have been attributed to the MRI. In cases of internal cardiac pacemakers, certain types of steel cerebral aneurysm clips, cochlear implants, and small steel silver embedded in the eye, the large static magnetic field could result in injury. Implantable cardiac defibrillators, neurostimulators, and bone growth stimulators may malfunction in the MRI, and certain prosthetic heart valves may be subject to strong forces. Minor superficial burns have been reported when the skin has come into contact with uninsulated wire leads near the transmitter coils, but taking proper precautions prevent this from happening. Patients should leave anything magnetic outside the scanning room, for example, credit cards, watches, hearing aids. Now we'll just show some samples. First, of the face. Here's a normal coronal T1 enhancement showing MRI scan showing structures like the frontal bone, sphenoid sinus, nasal cavity, tongue, and temporalis and masseter muscles. Now an ethmoid tumor. The image is a coronal MRI section showing a tumor invading the ethmoid sinus and the frontal lobe of the brain. Lastly, an image of a cyst, which is seen in the darker black spot at the back of the tongue. This is a sagittal T1 weighted MRI. Moving on to the head. First, a normal MRI of the head. Next, a tumor, in which image C is a non-contrasted T1 weighted image, and image D is an enhanced T1 image, both showing a mass and midline shift. The third image, E, is a T2 weighted image. Does not show the tumor as clearly, but the edema is seen as in increased areas of white. The next abnormality is a subdural hematoma, and in the image you can see the compression of one of the ventricles and the overall swelling of the brain. Lastly, we'll look at the neck. First, a normal MRI of the neck, followed by a disc herniation between C6 and C7, which is seen as a dark bulge protruding in the spinal cord. And lastly, a bilateral facet dislocation. And we provide a reference table that displays characteristics between a T1 and T2 signal in common tissues.